in our communities. We have overcrowding in our housing. People, 3, 4 families are living together, more than any population in Canada. And as the first population Indigenous to Canada, we need that vaccine.
I think it's important that if there's something out there like a shot, a vaccine, that can help you navigate whatever is coming at us from sickness, that we do it. We do it for our elders, we do it for our children, we do it for ourselves.
I have a daughter at home with cystic fibrosis, and it's definitely, in my opinion, not only for her, but other people with health problems, and it's definitely worth getting vaccinated.
I was confident in getting my vaccination simply because I did have COVID before it was offered, and it was a very difficult experience.
My wife got COVID-19 and she was pretty sick, and I think I had my first booster shot. She gave me a PHAC and she got sick and I didn't, so I believe that's one of my reasons why I think the COVID vaccine works.
I worked the COVID unit. I worked as a manager in the COVID unit in the acute care hospital, and I spent a lot of time in the ER. And through that journey, I saw a lot of people come in, and we were scared. We were scared as healthcare professionals.
The government has provided information, and since the inception of the vaccine, now they've come up with more information, all kinds of fact sheets. You can get that information online. You can get it from your healthcare provider.
It's so easy to get the shot. It literally takes like 30 seconds. You're gonna go in, you might sit down in a chair, you're gonna pick an arm, and a nurse is gonna give you a tiny little poke right here in your arm, and that's it, you're done.
In the end, having my vaccine opened up a lot of doors for me to be able to participate. In order for my grandson to continue to go to hockey, he needed to have a vaccinated adult with him on the ice, which meant me putting on my skates again at one time and getting back out there on the ice, which has been a long time for me.
Well, we wanted to get vaccinated, not also for our health reasons, well, my health reasons, but to get back out playing sports again. Just like I said, feeling normal, being able to interact with people.
I would urge you to get the vaccine. I would be confident in the vaccine. As a traditional Anishinaabe Kwe, I do believe in my traditional medicines, but every talk that I've ever had, I would say that anybody would tell you, trust in the science as well, because we work hand in hand with our traditional medicines.
I hope that others will follow that path if it's within them and have the belief of wanting to be well.
If you're fortunate enough to have somebody love you, then you should get the vaccine.